Okay. There we go. Thank you very much for that introduction, Brenda. And wow, what a great way to just kind of get grounded before doing a presentation to people. That was lovely. Thank you for letting me participate in that process with you. Yeah, Brenda and I do go back a long way. And when you're finished, or when my presentation is finished, you'll understand why canoeing is so important to me, because it is truly, because of my work, it is truly the only way that I get to unplug, because I support over 70 volunteers who at any time of the day or night or weekend may need me. So we try and go as far away as possible on our trips where there is no cell service, so no one can reach us. And we did have Mark join us on one trip. I think was it just the one? And I discovered how playful Mark is. Anyways, you can ask him about the story with the deer skull at a later time. So I'm going to try and, I know I have limited time, so I'm going to jump in and get started. But I really hope that you're going to get a sense of what an amazing community Sarnia Lambton is in terms of collaboration and how we work so well together with social services, with the medical community. I mean, Brenda was a part of that collaboration when she worked for Family Counseling Center for many, many years, supporting adults with developmental disabilities. And so what I'm going to try and do is paint a picture for you that illustrates how our programs are very much interconnected within our agency and within the community. So I want to start, first of all, by talking about Tel-Check and then the Distress Line. So the Tel-Check program provides outbound telephone support calls to isolated older adults and seniors or adults with disabilities who live alone. Since the pandemic, we've really opened it up to anybody who is feeling isolated. We've opened it up to couples where one of the couples might be dealing with dementia, Alzheimer's, and then the partner is struggling with caregiver stress and burnout. And so sometimes our volunteers are making calls to the individual who is has a health issue, and then providing support to their caregiver as well. So our volunteers make these calls daily or a few times a week between 9 in the morning and 10 o'clock at night. So when we set someone up with Tel-Check, we ask them, what's the best time of the day for us to contact you? So there's lots of room for them to fit in. Volunteers check in with the clients regarding how they're coping or if they need any additional supports. You're going to hear me talk about pandemic a lot, especially during the pandemic, because there's been so many restrictions put in place that it became really important for us to make sure that the people that we're connected to are getting the services and supports that they need, such as transportation. We ask them, are you getting your groceries? Do you have someone getting groceries for you? Are your medical needs being met? We were hearing a lot from a lot of our seniors that their doctors weren't seeing patients. They might do it virtually, but I don't use a computer, and it's hard to do it over the phone, and I can't always get in. And so, helping them to navigate getting that health care has been a part of a role that we've taken on as well. And then social supports. A lot of our clients are socially isolated now, especially those whose families live in other communities. They used to stay in touch by having weekend visits, and or mom would go and stay with the kids for a week, those kinds of activities. But we're seeing that that's not happening as often anymore. When we call our Tel-Check clients, we also make medication reminders, and we've seen some great successes with that, where some of our clients were really struggling with their health, and a big part of it was because they weren't consistently taking their meds. So we help them to remember to take the meds. We have some clients that we call 3 times a day for med reminders specifically. We ask them about nutrition. Are you eating? We all know that it's sometimes not as much fun when you're cooking for yourself, So we do check-ins to make sure that our clients know that they can keep frozen meals from Red Cross or some of the other organizations that are providing meals to seniors during the pandemic, that they can keep them in the freezer, and on those days that they don't feel like cooking, pull them out of the freezer and you've got a nutritious meal. Hydration reminders, that's a big one. And we've done that more since the pandemic, because what we're realizing is that our clients are not getting out. They're not going out with family members. Family members are not coming in. And so they're forgetting to drink water and cups of tea and stay hydrated. We also do security check-ins. So we'll ask our clients, to make sure that their doors are locked, stoves are turned off, etc. So I thought I'd, oops, sorry, I just realized I missed something. I thought I'd give you a sense of some of the unique calls that we've had over the past few years. I jump in and do the work right along with the volunteers when we don't have someone to cover a shift, which is great because then I get to know the clients as well and develop a relationship with them. And with the Tel-Check program, we do try and develop a telephone friendship with our clients, which is much different than the distress line, which is what I'm going to talk about next. But I wanted to just mention a couple of stories. I had contacted a 93-year-old woman who lived in a small community in Lambton County. And because we had a relationship, she's been with us for many years, she disclosed to me that she's been having multiple falls in her apartment. So I already knew that she had PSWs coming in almost daily. And so I asked, are you letting the PSWs know? Does your doctor know? And she said, no, I'm not telling them. And I said, well, tell me why you're not letting them know. And she said, because I'm worried that I'm going to get forced to go into a nursing home. And I said, well, if you look at it a different way, if you can prevent those falls from happening by telling your doctor, then you will be able to continue to live independently because you're not going to suffer injuries. So one of the things I asked her is, I said, are you drinking water every day? And she really very proudly responded to me by saying, I have a bottle of water sitting next to me at all times. And I knew she was a bit of a stinker. So I said, okay, well, that's great. But are you drinking it? And then she started laughing and she said, well, no, not very often. And so I said, could you please do me a favor? Could you increase your hydration? And could you please reach out to your doctor? And so she did promise to do that. And then a few months later, we did discover that she was going to be able to move into a retirement home that provided some meals, but also offered independent living. So she was pretty excited about that, but also worried about how was she going to pack everything? How was she going to figure out what to keep and what to get rid of? And so we were able to put her in touch with a community organization that was able to help her with that. So she was very appreciative of that. We've been supporting our clients through multiple losses. So losses of a loved one and also losses through restrictions. So that loss of freedom to come and go as they please and be with friends and join them for coffees, etc. We also recently had an 84-year-old client who gets called for medication reminders every morning. And when our volunteer called him, and this particular volunteer does this work 3 mornings a week, so she calls them her clients. Those are her peeps. She really gets to know them. Well, she knew that something was wrong with this particular gentleman, and he was actually presenting with stroke-like symptoms. So because of our new phone system that we have, she was able to connect with me and link me in and do a conference call so that I was a part of that call, but also able to, with my other phone, reach out to EMS. So while we were waiting for the ambulance to come, the dispatcher was asking particular information about the client. I was able to share that to them. EMS got there. We also have family contact information. So while we were waiting for all of that to pull together, I was calling his daughter down in the States. And then he also had a son who lives 3 hours away. So we were able to pull all that together, and we got a few phone calls from the family members after that, thanking us for being involved and taking such good care of their dad. And they're very tuned into him. And as a result of what happened that morning, so he was hospitalized, he's gone to live with his son until they can make other arrangements. So a positive outcome to that story. I thought you might be interested in seeing some statistics and the number of calls. So in 2019, we were making approximately 80 to 85 calls a day. We're upwards of 190 to 200 calls a day now. So you can see in 2019, we were just over 29,000 calls a year. And then last year, I couldn't believe it when I looked at the numbers and saw that we exceeded 54,000 calls. Our volunteers do incredible work, and they work very hard to try and balance those daily calls in a way that the clients don't feel rushed, that they can, they're going to end the call feeling like they had a good conversation with us, but the volunteers have to be mindful of the length of the calls. So they do a fabulous job with our clients. So that's Tel-Check. So that's outbound calls that are made. So we also have volunteers that receive calls on the distress line, and some of our volunteers work for both programs. They'll sign up for a Tel-Check shift or a distress line shift. So the distress line volunteers receive inbound calls from people of all ages from 7 in the morning until 11 o'clock at night, 7 days a week. We used to provide overnight service, but with the increase of service admin, requirements, when the pandemic hit, we had to cut out our overnight. It wasn't the busiest time for us. So we really wanted to focus on those times when callers are calling us the most and really need us. So our volunteers' role is to provide a sounding board, so that listening ear. We provide callers with empathy, support, validation, all those things that they might not be getting from their supports in the community. We are always doing risk assessments for harm to self and or to others. We cover all topics: grief, domestic violence, suicide, mental illness, addiction, self-harm, eating disorders, the list goes on. And our volunteers are trained to do interventions when necessary. So what we've noticed since the pandemic, and obviously because of the increase in the number of people who are calling, the issues that we're dealing with are much more complex. So if you think about people who were already marginalized at the onset of the pandemic, how isolated and alone they must be feeling with what they're struggling with, especially those with mental health issues, depression and anxiety. We're seeing a huge increase in callers struggling with those issues. We've also had an increase in calls from women in abusive relationships. So we've helped them with safety planning, making sure that they know that they can reach out to the Women's Interval Home for support as well. An increase in calls from men struggling with anxiety and depression. Actually, the other day we had 2 young men calling from their workplace, actually a colleague calling on their behalf, two separate workplaces, because the individual was having an acute panic attack and didn't know what they could do for this person. So we help them out to, make sure that they know that they can go to the ER, talk to them about grounding exercises, doing breath work, and also reaching out to Canadian Mental Health Association, because they are running groups on coping with depression and anxiety during the pandemic. Again, an increase in losses, an increase in people contemplating suicide. We had a young woman who, had a fight with her boyfriend later on in the evening, and she was devastated by it. She took a bunch of pills, got into her car, was driving out in the middle of the country, and started to feel the ill effects from the drugs that she took and got scared. So she pulled over in her car and reached out to us. She wanted help. She didn't want to die, but she didn't know where she was. So to keep this anonymous, I'm going to use a county road just out of my head. So let's say she knew that she was on Townsend Line, okay, somewhere outside Forest, but she didn't know where, and that's quite a long road, and she could be, you know, anywhere. So she was willing to get help. So the volunteer again connected me into the call. I contacted the OPP because we knew she was in the rural area. And we had a very creative dispatcher who looked up the road. Oh, so we asked if there were any markers, any kind of identifiers that she could give us. She said she knew she was near a railroad track. So this dispatcher went to their map that they had on the wall, followed Townsend Line until it crossed a railroad track. So she was able to dispatch the police. OPP got there. We asked the caller to let us talk to them, which we did, and impressed upon them that she had indeed taken medication and did need to go to hospital. So they contacted their EMS, I think, was already on the way, and they were going to take care of her for the night. So pretty impressive work between our volunteer and the caller being brave enough to know that, to realize that she wanted to choose life, and, you know, for us to be able to get that particular dispatcher on the phone. Otherwise, we would have had to go through Bell Canada. They would have had to do a trace on the line, and it could have become more complicated. The caller also at one point thought that she would start driving again and try and find her way. And the volunteer said, no, 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 turn the car off, set the keys to the seat beside you. So our volunteers we never have any idea what kind of calls we're going to get. And in training, I talked to them about, in a way, we're being blindsided by every call we get. But those kinds of crisis calls aren't the norm. The norm for our volunteers are callers who just need a listening ear, just someone to empathize with them and to validate what they're experiencing. That's mostly the work that we do. And then I thought you might be interested in our stats with Distress Line. Again, like 2019, just over 1,700 calls, and then last year, over 3,300 calls. So we've been busy. So that's Tel-Check and Distress Line. We didn't think that we were doing enough, so we decided to add another program. So it's called the Older Adults Care Pathway, and I'm going to talk about that now. So the background behind that one, and it's just been going for over a year, about a year and a half, is we knew that the second wave of the pandemic was coming. We had a meeting with Dr. Renaday, and to quote him, he said he wanted to ensure that no one was going to be left behind. And he was talking more specifically about older adults and our seniors in our community. And what I already knew we were hearing from our seniors is they didn't know who to call. They didn't know where to go for help. And often when they were reaching out for supports, they were being placed on hold. So often what was happening is they'd call someplace, and these places were saying, no, we don't do that here. But not many of them were offering to help find the pathway to the organization who could provide them with the appropriate information. So Dr. Renaday on October 2nd, 2020, wanted to pull together a brainstorming session. And so he asked representatives from both the medical and social services community to come together. So I had already been on, I don't know if you've heard about the work that the age-friendly kind of collaboration that's been going on for Sarnia Lambton over the past few years, but I've been sitting on a subcommittee of that working group. And so I was asked to come and attend this meeting as well. And so what he was asking was, how can we get in front of what we know is coming to ensure that older adults and their caregivers and individuals who are at greater risk at serious health implications can remain safe and in good health at home? What can we do to ensure that? So what we did as a group was we took a look at potential gaps in service. So Dr. Renaday stressed the importance of a collaborative approach to ensure that these folks are going to have fast access to both medical and social needs being met, regardless what it is they were looking for or needing. So I kind of just at the meeting, there were some big shots there around the table, and just me at family counseling, but I kind of raised my hand and I said, we're kind of already doing this through the Distress Line and the Tel-Check programs. We've been providing information and referral to medical and social supports in Sarnia-Lambton for over 45 years. So I'm wondering if maybe we can just talk about perhaps what we need to do is enhance that, what we're already doing. So we talked about it, and it was starting to make sense to the group. What I also said was that our biggest challenge, or my biggest challenge, was to let the community know that we existed, especially the medical community. I couldn't kind of break in. We weren't getting doctors and nurse practitioners or the health centers referring those isolated seniors to Tel-Check or to the Distress Line program. And especially now with the pandemic and how busy we were getting, I didn't have, I had to be there to support the volunteers. I didn't have time to go out and market our services. So fortunately, talking to Dave Brown, we were doing some brainstorming around how we can still be there for and be able to provide an increased level of service to our community through Tel-Check and Distress Line. So he helped us to get emergency funding through the United Way, through the federal government, and through Public Health Canada. So I was able to actually hire a couple of our retired senior volunteers to help me support volunteers and to do some of the admin work. We wanted to make sure that our program volunteers were going to be able to continue to receive calls and make calls to people who are struggling in isolation and help them endure the rippling effect that was happening to all of us as a result of the pandemic. So that's the thing I'm often reminding our volunteers about when I'm praising them for the work that they do, is not only are we supporting people who are struggling with the pandemic, but we're struggling as well, every one of us. And so good for you for being able to step outside of yourself and be there for others. And what I hear from them is that often it's because of that work that it helps to put their own situation in perspective and help to get them through what they're struggling with. So what I was able to share with Dr. Ranaday and the group was that we've had this database for years that it has a volunteer management component. We put client profile information in, we've got personal medical information, any special instructions that are needed for our clients about the medication or hydration reminders, cognitive tracking. Our volunteers will keep notes on how the client was doing that day. And if they were struggling, we might give them another call later in the day, or contact a reference on their behalf. We also track if clients have been in hospital or have had some surgery or health issues. We'll follow up with them and see, just to make sure that they're still doing okay. So we have been able to develop the capacity as a result of the funding that we've received. It's given me some help because I have always been the only paid staff member running these programs. So obviously from the stats, you can see that we have been able to deal with the increased capacity. So it did become evident that we could become a single point of access that Dr. Ranaday was looking for. And what he was promising to us is that Lambton Public Health would help to promote the services with both medical and social services, or promote the care pathway. And so they have been doing that quite successfully. So some of the things that we already knew is that in Sarnia-Lambton, in our community health centers and social service agencies, we already have care coordinators and connectors and navigators that were already set up for both the medical and social service supports and referrals. Social service agencies were already adapting their programs to work virtually and or by phone or using other innovative ways. They were updating their websites regarding the changes, how they're providing the services. So that kind of collaboration had already been happening in the first wave of the pandemic, and it just began increasing. There's new committees that I'm sitting on, so I'm connecting with these navigators and the core care coordinators to make sure that there aren't gaps in service, or if there are, how can we brainstorm to close those gaps. So that's been happening. So we promote the care pathway through public health. There's an age-friendly website. If you're not aware of it, please visit it. It is primarily focused to older adults and seniors, but they're also going to now start including services for people of all ages, and then 211 as well. We also rely on people like you when I come to, do a presentation, that you can maybe perhaps refer other people to the service. We rely on the medical community and social service agencies. There's been news articles, press releases. I've done all kinds of presentations out in the community. I have pushed my limits, especially being on the radio. That was outside of my comfort level, but I got through it. So I thought I'd give you a couple of examples of how people have used the care pathway. So we had an 82-year-old gentleman who heard about us. He called and he was saying he wasn't able to get in to see his doctor, but he was experiencing some health issues and he was looking for a walk-in clinic, and he had no idea. He'd heard about them, but he didn't know where they were, how to even reach them. So one of the things we were able to do was determine that his doc is affiliated with the Rapids. And if you're familiar with the Rapids Family Health Team, there's an abundance of doctors who are connected to them, which then gives access to those doctors' patients to go to use their walk-in clinic, to access other support services that they provide. So this gentleman was able to reach out to the Rapids and get connected with them and get the help that he needed. We also received a phone call from a woman who had just returned home after 2 years from living with her kids outside of Sarnia-Lambton as a result of having a stroke. She wanted to come back to her home, but winter was setting in, and she knew that in order to be able to live independently again, she was going to need some services. So we got her connected with Habitat and Lambton Elderly Outreach for snow removal, yard and home maintenance and repairs. So she was most appreciative. And then we signed her up for the Tel-Check program. She thought that she would benefit from a daily phone call. So again, just another success story. And then one that I really appreciated being able to do was just prior to Christmas, we had a referral from an individual who had sustained a brain injury, and he needed to receive 4 medication reminders a day over the course of the Christmas holidays before he could get connected with March of Dimes. So we were able to do that for him, and we helped him to journal to keep track that he had taken the medication. We've been supporting, and so then March of Dimes stepped in, and end of story. And he's being supported again. We've had clients with behavioral issues, especially significant mental health issues that have burned all of their bridges. And this one gentleman in particular, we've had to call police and mental health nurse on him several times for suicide threats, and set boundaries with him in terms of how he speaks to and treats some of our volunteers. But we spend a lot of time working with him because we don't want to give up on him, because we're kind of his last resort. So we're working a lot with him. And then we had a senior female with dissociative identity disorder who needed 3 med reminders. When we first started calling her, we were talking to her alters. So it was a child that would come on the phone. She wasn't getting her meds. And so we started making 3 calls a day. And within a month and a half, we were hearing less and less from her alters and more from the host. So she's been a huge success for us and has stayed with us for several years now. So if you're wondering about, gee, I wonder if somebody could become a Tel-Check client, I'm worried about them, just call me and run it by me. I rarely say no. And that's another thing I'm really proud about with the Tel-Check program. We do our best to fit our program to meet the client's needs. We don't make them fit in our box. And so that can be a very unique thing for some of our clients. So, and also when we do a refer or receive a referral and do an intake, we can be calling that client within 24 hours or the same day if necessary. So I understand that this is being recorded. This is the contact information to make a Tel-Check referral and to reach us through the care pathway. So watching the time, I'm winding down. The last new program that we added was the Children's Helpline. So we've developed a working relationship. I mean, we all have always worked with St. Clair Child and Youth, but they reached out to us because they wanted the development of a single point of access for children and youth. And then when I was thinking about that, I wanted to make sure that parents were going to be included as well. So what St. Clair determined was that locally, if our kids are struggling, it's helpful for them to reach out to someone who is familiar with local supports and services, familiar with the Sarnia-Lambton community. And then for parents, if kids are derailing, they need to know who do I turn to? What do I do? I'm really worried about my son. I'm worried I'm going to lose him. So we also know that if parents are getting the support that they need, they're going to be better equipped to support their kids. And so often what we do is we'll refer parents to Family Counseling Center, which I haven't talked about yet, but we provide family, couple, and individual counseling to people in Sarnia-Lambton. We have a team that works with adults with developmental disabilities. We have a team that works with victims of domestic violence. We've got multiple programs, many of which are completely funded, some of which are partially funded, some are fee for service. So what we know is that if kids are feeling supported, validated, and have a neutral sounding board, their level of upset is going to be reduced and they're going to be better able to cope. We actually had a 14-year-old who developed an eating disorder and anxiety disorder as a result of the pandemic. So we pulled her into the Tel-Check program. So we're really shooting for the stars. We're, doing what we can to keep the funding coming in so that we can be that single point of access for people of all ages looking for information and support. By the way, we're always looking for volunteers. So I'd like to thank you very much for having me, and I appreciated being here.